very stable now. It's not stable, it's very stable. So stable that she can start standard one homeschooling from July onward. We have this, they're not for special help. This homeschooling is for normal children. She can go there, and she said very gratefully, it's like, finally, she said, finally, at last, the child is very, very good. And I asked her again what childhood product and dosage you're giving her daily to give this testimony because I asked her permission. So she wrote here, you see, as per your guidance, 6 sachets lactoberry per day, and I added 1 sachet YKI. Very bitter, so I divided it 3 times mixed into her milk. Now, when the school she goes to, the therapy school, one of the mother's son is even worse than her child. Saw this, she started this dosage. Now it's already the 2nd month already.
No,
and then another mother saw it. So no need to talk already. The product talk already. So she started to see that she can help other children also. Because other parents also in a dilemma. They have tried everything. And it's very, very heart-wrenching to see the child always crying and non-stop. And don't know why. Because she just cannot stop her emotion. Okay? Next. This is the mother. That's why she gave the child the Lingzi. She took Jiahe Lingzi 2 tablets for 4 years just to maintain her health and 4 pollen every day for 4 years. But maybe because she is having some hormonal issue and have a child like that, just for maintenance to Jiahe Lingzi. At age 35, she was diagnosed July 2025. That means she started the Lingzi at 2021. So at July 2025, she was experiencing persisting abdominal pain for 10 days since 19. So she consulted a gynecologist, and it shows that her cancer marker, the CA125 level, is 83.8. The normal for CA125, which is for ovary, is 35. I know it very well because I have endometriosis, adenomyosis 24 years ago, and also in situ carcinoma of the cervical. That means cervical cancer, but I was very lucky. It haven't actually changed yet, but it's very in situ already. So her left cyst is 5 cm with solid area, and her right cyst is finger-like unusual shape. This is not good. Because unusual shape means there is something not right. So the doctor advised her to take this medicine called Visane. It's a synthetic progesterone. Synthetic progesterone, so to handle certain hormones in the body. But there is a few side effects. You can check it out with ChatGPT, which is not very good, okay? And then she took it for 3 months as an alternative to immediate surgery. Luckily, the doctor is very good. He just said, take this. So she asked me how to take Lingzi. And the 2nd July, she took a high dose of 2 Yongkian sachet pollen, 2 sachet YKI, and 2 Yongkian I 3 times a day. That means total how many? 6. 6 of each a day. Next. 1.5 months later, she was taking the mid-August. She followed up a consultation, and her left cyst was completely gone, and then her right cyst has shrunk. So she took until another 3 months, the same dosage, but during that time, her period flow became heavier. Now, anybody of your customers have this endometriosis, adenomyosis, or fibroid or anything, this healing reaction will happen. The period flow will be heavier, and also she will have this bowel movement a lot. you will have a lot of power movement and flatulence, gas, very, very smelly gas, okay, coming out. But very strange, if you take the product in the right dosage, the effective dosage, you will not experience any pain. So luckily, she took 6 sachets of YKI. My time, 24 years ago, 1 bottle of Legend, 1 bottle of Polo. I was 37 then. Today, you know how old I am, 60. I have more problem than her. I have eczema, full-blown eczema. Like double diamond coup, I have gastric ulcer, a hole in my stomach. Okay? And then I have cholesterol 8.8, which I have a mild stroke before I started shampoo. So a lot of problems. I took a lot of steroids last time. Oral and actually on the skin steroids too. Now, by the 27th September, 3 months later, she had all her cysts gone. Her mother was in the clinic with her. Her mother, when she walked out of the clinic door, her mother cried because the doctor was not very, the doctor face gave her when she was diagnosed, was telling her that it may be something mutated cell. So when the cyst was gone, everything was gone. Her mother, who is also like me, 60 years old, who is a businesswoman, do not believe in Lingji. For all these years, she's taking the Jiaho Lingji for maintenance. But her mother that day asked her, you call this lady, you call me, I want to see her. I said, I cannot see you because I'm in Nepal. I'm doing a home coffee party. She wants me to go to Rawang in Malaysia. Then her mother said one thing, I don't care. You give me the highest dosage for my age. I said, you say what now? So I said, 2 YKI, 6 YKS, 5 to 7, 2 YKB, 2 pollen, 3 times a day, 2 lactoberry, 2 Waitaki a day, but the lactoberry and the pollen must be 6 sachets. Protein, I will introduce you. Afterward, you sure don't like one. I will go to and tell you how to make. She took the product for 5 months, her mother. Then she said, no other MLM product can give me a reaction. I don't think yours can. The third day she called me already, she scolded me. What product is your Lingji? I said, what happened, Jennifer? Her name is Jennifer. She said, so painful, my stomach so painful, my head so painful. I told you already, you say, no reaction, I give you a reaction. So she said, what to do? Nothing to do. Your dosage very high already, premium already. The only thing you can do is rest. Because I say, you mahjong every night. Every night mahjong for 10 years until 12 o'clock. All her neck here, sure pain one. You play mahjong, you do like computer like that. So I said, and you don't exercise. Number 1, and number 2, you don't eat properly your lunch and dinner. You cook already, you go out and play mahjong. Not I say one, I say your husband and your daughter say one. I tell you, ladies and gentlemen, these 2 ladies and the child, I have never met. Only on Zoom and call, even in Malaysia. I have never met them. They don't have time, they say they're always busy one. So, but they took the product so good until the lady also called her auntie in Singapore to meet me. The auntie, yesterday, I called her. She said she's not free. Never mind, we talk on the phone. I so never so the product talks. Sometimes in Singapore, one thing is not good because the product are very powerful. It talks already, we cannot have a connection with the people. Only one thing called product very effective. Okay, that is one of the issues. Cannot connect education because the product was free. Next. This is mocha. It's a breed, two breed, Persian and Musky mix. This cat belongs to the lady upline. Her upline is, I know her 18 years ago in a shopping complex by, Le Creuset, who cooks here? The Le Creuset pot. Okay, and her upline started with coffee. So her upline trusts the Lindsay very much because her upline has a tumor up on top of her kidney pinot. She blacked out for 2 hours in her room. She was admitted to hospital and the doctor said that the tumor is not, it has not metastasized yet. They can do a surgery. That time, we don't have the ETL into. She took 15 capsules of YK2. She saw very tremendous results because after the surgery, she recovered in 2 weeks, which the doctor said is very amazing. And after that, she introduced a lot of her family to eat. Now, this cat, because she bought from China, is RM12K, which is Sing dollar 4K, right? 4K Sing dollar. She has Balanite species, the bacterial infection, and caused the penis to swell. And this cat was given 7-day antibiotic. However, the swelling cannot come down. So of course, call me again. This time the cat okay? So I give her one tablet of NutriHealth, which is in Singapore is called wellness tablet, right? One NutriHealth, half tablet of lentil, half tablet of pollen. So she put into the cat mouth, make her swallow. Then the cat so she make into powder and put into her food. The next day, the cat see the NutriHealth coming out, she run. So catch the cat, put again inside the mouth because want her to swallow. This time, the cat swallow lah. Then after that, they just make into powder and put into her. And then on the third, I asked her to increase to 2 tablets. Then she had reaction, the cat. She vomited some fluid and undigested food, but the cat is active, okay. Then by the fall, she added in 1 sachet of lactoberry, and then the penis no more swelling and the appetite good. So now mocha honey is continue with 1 tablet of NutriHealth and every day, but lactoberry 1 sachet, she separate into 3 days. That means 1/3 every 3 days. So the cat now don't run when she see the NutriHealth. She take. No mind. Every living thing that take Lindsay one, even babies, after they take, they feel very good. They will take one. So this cat, 4,000 Sing. I say, how much is the NutriHealth? In Malaysia, it's less than 100 ringgit. It's worth it. Lactoberry 1 box cannot finish 1 month, maybe 3 months off. So it's worth it for the cat health, because this kind of bacterial infection is very, very determined. If you're not careful, the cat has to go through some very bad reaction, and then it costs more money because 1 time vet is about 300 ringgit Malaysian ringgit. It's a lot of money because it's a high-class cat. Next. This lady is 73 years old. She only drinks the coffee 3-in-1 since 2018 for 7 years, every month 4 boxes. Because she got what? She got coffee shop. My downline went to the shop, asked her what she wants to know, 111 CO coffee or not. She thought my downline is selling coffee for her kopitiam. Then she sat down, she drank our coffee, she liked it. She don't take medication regularly. She's a Muslim. She married a Pakistani, okay? She's a Muslim. until April 2025, she had to do a cataract surgery and her BP went up to 190, her systolic. Then she took 12 capsules of our Yongjian for 3 weeks. BP reduced from 190 to over 110 to 139.76. She continued taking the 12 capsules for 2 months. Then on June 2025, she did a left cataract surgery. Her PP maintained. However, another eye surgery, her eye was red and painful. So she went back and she took 2 vitamin 2 and 6 things every day for 1 week. Then the redness gone and no more pain. So the maintenance dosage from July to December 2025, 2 capsules of Yongjian and 2 sachets of CO coffee. Yeah. Okay, coffee. This is the Lindsay that she take, and this is the vitamin 2. That is the first case. Now, this one is what happened to her. The next one. March 8, when my downline called her speech already slurred. So my downline asked her, "Are you okay?" Because he knows already this person have the sign of stroke. Immediately she was taken to HKL. Because my downline didn't have any Lindsay, only the NutriHealth. Because HKL is a government hospital, you cannot fit Lindsay. So what he did is, he put the NutriHealth, the half tablet Lindsay and half Yong pollen into her mouth, asked her to chew. So when the doctor turned, when the nurse passed by, he quickly put inside her mouth, asked her to chew. So she chewed 10 tablets of Nutri, 1 at a time. Her BP that time is 190 over 130. Then the next day, she went to the normal ward. He put 60 capsules into a cup, and then put 4 vitamin because there's a time for you for visitors. Because it's HKL, it's not private hospital. So they're very strict with visitors. So what they do is, he put into a cup and he made for her. Immediately she had to drink the whole 60 capsule plus 4 vitamin, the concoction. Third day she can talk, she can grip, and BP is 139/80. 3 days only, 60 capsules of the Lindsay. On the 14th, she took to the 17th, she took 10 capsules. Because on the 11th and on the 12th, her husband stopped her from taking. Because her husband say 60 capsules maybe can die one. Okay, I'm sorry, because sometimes family members doesn't understand. And because he is Pakistanis, he also don't have time to talk to him, so he stopped her. So 14, she secretly took 10 capsules, Lindsay, and 1 vitamin, and discharged for Hari Raya. Then on the 18th, normal one, she told her upline, "Let's do again 60 capsules," because husband not around. So 2 sachets vitamin 2. And she was admitted for observation because the doctor suspect that her stroke have to be something else. So he did an MRI, as you can see, and you know what MRI came up the result. She has recent stroke in left brainstem, which is true, but she has multiple previous stroke, And then significant small vessels, and her brain is shrinking, which is called atrophy. It's related to aging and vascular disease. Before this, So sometimes you were thinking, she took 4 sachets of coffee for 7 years. Couldn't be the coffee that can help, Or could it be? I don't know. Because she has multiple serious stroke before, So on the 20th of May, she started to walk, talk, shower, eat, and walk up staircase by herself. Averagely, her BP now is 131/180 to 160/89. The reason why she is like that is because she have long term of having two business. One is kopitiam, one is she had a tailor shop that do uniform. So her eyes always looking at the sewing everything. So she is she likes to do a lot of business. So when she got this stroke, she was crying in the hospital. My outline, which is a guy, told her, very, very loving guy, told her, don't cry. Now it's not the time to cry. So next, you can see, next, in this is how black, how concentrate 4 Waitaking and 60 capsule of Lingzi. Next. You can play the video, Tamiku. Her hand can grip. This is her outline hand. Can grip her outline hand. On the May 6, 10 Yongken Lingzi to 2 sachet coffee, 1 Waitaking, 2 Jahal protein pollen capsule, all to the 26th. Total, she have taken 3,283 RM for the whole course. Ladies and gentlemen, is it worth it? Yes. Multiple stroke before, 72 years old. I'm 60, I can imagine myself suddenly have this, and who can help me? Even if I go into the hospital, who can help me? Now, this is the distributor. As a distributor, we are the one that do not only the physical part, the intellectual part is very important. This person so caring, he goes to the hospital 3 days to make this concoction for her in a what you call a government hospital. And because her neighbor saw her come back as if she didn't have stroke, so now all her neighbors start to ask what she take. So these 2 months, the upline told me her network already grow to 5,002. 5,002 PV. You see, this is just a very fine line, a very fine gray line. If the upline just say, oh, I cannot go to the hospital or something, he was so convinced that 60 capsules of Lingzi and 4 Waitaking can handle the he made the concoction like that. I also don't know how the lady can drink. I also don't know how the lady can drink. You may ask why she don't, any one of you in your mind ask why she don't give YKI? Okay. Why Yongkian? YKI is a targeted Lingzi, right? YKB is targeted. Yongkian is the Lingzi that is the foundation of Lingzi. This lady with a stroke, you think only she got vascular disease? She got diabetic, high blood pressure, all this. She got all this problem. So Yongkian is the one that is overall. It's like KLCC, all the ETL is the tower. The foundation is Yongkian. Very powerful one, 60 capsule. We are the old diamonds, okay? Old diamonds. We know how powerful is one bottle. I take one bottle before for 3 months. Every day, one bottle, because no ETL that time. So we know. So we know how powerful this is. So that's why, and he said one more thing. If next time she is okay already, she not the financial is not so well, she can choose to take 10 capsule of 灵芝 Yongjian, or 5 capsule or 7 capsule. But for ETL, you must take at least 1 sachet to 2 sachet. So he also think afar for her. So that's why this is, if you ever don't know what happened to your consumer, if you ever want to, you don't know other things is happening in the body, 1 bottle of Yongjian in emergency, provided the person is willing to throw everything inside. You don't have to open one. You throw everything and put hot water, put Vita King. Very, very good one. Okay? Next. Next.